order if that's possible. And the first order of business is we are very blessed and fortunate. Good evening, everybody. On behalf of the Board of Education, thank you for joining us this evening. We have the honor and privilege of being joined by two healthcare professionals who are going to help us understand, not only the Board of Education, but anybody else listening, the challenges of providing for safe schools for our children in this very dynamic, ever-changing COVID environment. So, Superintendent, do you want to introduce our guests?
I do. Good evening, President White, Vice President Elliott, our other commissioners, our staff. Tonight, we have the opportunity to really have a dialogue with highly respected medical professionals. And I have to say that I am very, very grateful for just their support, for their work, and for their expertise. We know that we've seen many, many pictures of some of the sacrifices, right? There's just the physical sacrifices that our medical professionals have made, especially now during COVID-19. And they have just been a constant support, a constant resource. And we know that COVID-19, it has lots of medical aspects and health and safety aspects to it that myself and my team as educators, we're just not prepared to necessarily answer all of those. So if you remember the show, Who Wants to Be a Millionaire, they have been my phone of friends over and over and over again. And so tonight, they have a brief presentation, but they really want to hear from the board, all of the commissioners, what questions you have, concerns. Nothing is uncharted, waters. You can please feel free to ask them, but I have quickly counted them as not only colleagues, but as friends. So tonight I will have Dr. Shipley introduce the team that's here tonight. But we are so grateful for the support that you've provided. And what means most to me is that many of the medical professionals that will come to you tonight to talk to you, they are serving our children. And so that really makes a difference for me in particular. So with that, I will pass the quote unquote mic over to Dr. Shipley. Thank you.
Thank you so much for that kind introduction, Dr. Meyer-Small. I'm here as with this group of healthcare providers, as she said, really ready to listen to your concerns and to engage in a dialogue. We want to take a couple minutes to I would like for each person who has come in from our healthcare team to introduce themselves this evening. And then we do have just a few slides just to do a little level set of what we're seeing right now in terms of COVID-19 and the impact on children. And so I'm going to start off with an introduction. My name is Laura Jean Shipley, although everybody calls me LJ. I'm a pediatrician and have been in this community for over 25 years. I was formerly a primary care pediatrician at Panorama Pediatric Group for that time. But now I'm part of the leadership team at Golisano Children's and the Department of Pediatrics. And my role there is to focus on population and behavioral health. So social, emotional well-being and mental health for our kids. During the pandemic, because of another role that I have working with our many primary care practices who serve children throughout the region, I had a chance to really work collaboratively with the teams across all systems, our practices at Jordan Health Center, at Golisano Children's, at Rochester Regional, our family medicine practices and our pediatric practices, as we pull together to make sure that children were as protected as they possibly could be during the pandemic. And so you're going to meet some of the other people from that team who represent those different systems. So Lakia, Dr. Wilson, I wonder if you'd introduce yourself.
Yes, certainly. Hello, I'm Lakia Wilson. I'm born and raised in Rochester, been a pediatrician for about 13 years in the area. I'm, as I mentioned, a pediatrician and an adolescent medicine specialist. My primary place that I work is at Rochester Regional, Rochester General Pediatric Associates, and I am also the medical director of our 5 school-based health centers under Rochester Regional.
Thank you, Lakia. Dr. Tassini, would you go next, please?
Hi, and I remember to unmute. That's the first First trick of Zoom. I'm Brenda Tissini. I'm both an adult and pediatric infectious disease specialist at the University of Rochester. So I work in both the Children's Hospital and Strong Memorial. And my main role there is as one of the hospital epidemiologists. So that means I'm one of the leaders of our infection prevention and infection control program. So during the pandemic, I've helped our medical system as well as working with LJ Dr. Shipley to help our community partners and regional partners develop infection prevention protocols, plans, and guidelines for our healthcare settings.
Thank you, Brenda. Dr. Halterman, would you go next, please?
Sure. I'm Jill Halterman. I'm a pediatrician as well, and I work in the primary care practice at Golisano Children's Hospital. So we care for lots of kids from the district. I'm also head of the Division of General Pediatrics at Strong and executive vice chair for the department. I'm really excited to be with all of you today, so thank you so much for inviting us.
Thank you, Jill. Jeff, would you like to go next, please?
Sure. I'm Jeff Kazarowski. I've been a pediatrician for 25 years. I work on the leadership team at the Children's Hospital, and I know some of you also from the role that I have as a senior advisor to the Children's Agenda.
Thank you, Jeff. And we are also joined by one of our colleagues who I don't think needs an introduction, but I'm going to let him introduce himself anyway, Dr. Mendoza.
Good evening, everybody. Dr. Mendoza, I'm the Commissioner of Public Health for Monroe County, and I'm also a family physician, seeing patients at Highland Family Medicine and also working on the inpatient service at Highland Hospital.
Thank you. So that's our team. I wonder, Kalia, would you be willing to start the slides? So Jeff, I think if you would like to start us off, we could advance to the next slide.
Sure. I want to say thank you very much for the opportunity to talk with you all today, President White, Vice President Elliott, and board members Adams, Clark, LeBrun, Malloy, and Powell. Superintendents Myers Small and Nelms, and of course, our special monitor, Shelley Jallow. We have really been working incredibly well with the district and with folks at East High School this year, and we want to continue that. And the most important thing that I will say at the beginning of this presentation is we are all in tonight to help, to answer your questions, to help make sense of what's going on in this crazy time of this pandemic, but afterwards as well, to work with you to really allow our kids to return to school in a safe and healthy way. So I wanted to just outline a few facts. Overall, as we first began to talk about the pandemic with school leaders, one of the concerns was, that kids were getting sick and dying of COVID. And that turns out not to be true at all. We've had a few children who have been infected with COVID overall in Monroe County compared to adults, and those infections have generally been mild. In the whole time since the start of the pandemic, over the course of 9 months or so, we've only had 10 kids hospitalized at all in Monroe County. And that's out of approximately 130,000 school-age children. For comparison, a disease that you all know and probably have some family members that have, asthma, we hospitalize about 10 kids a month for that. That's how much more common it is. And if you looked overall at an average size school district in Monroe County of about 5,000 kids, at this point, after a whole 9 months, only about 35 out of those 5,000 kids would have even been diagnosed with COVID. So COVID and the pandemic, we don't mean to minimalize or trivialize at all, but our kids are doing better in terms of infection. You could advance to the next slide. But what you all also recognize is that our kids are really sustaining a lot of damage from this pandemic, right? These are headlines pulled from leading papers over the course of the last months. The pandemic will haunt today's children forever, but we can help them now. Vaccinations fall to alarming rates, CDC study shows. Children are not the face of the pandemic, but they risk being among its biggest victims. So what are we talking about here? What does this mean if kids aren't being directly infected? One of the first things it means is that more kids are falling into poverty. United Hospital Fund estimated for Monroe County, 10,000 more kids will fall into poverty this year because of the pandemic. 10,000 more. And if we do the math, we would say that about half of those kids will be in the city of Rochester. There is a learning crisis associated with COVID. We know from national data, from both Credo at Stanford and from NWEA, that overall on a population level, the loss of schooling at the end of last year and virtual schooling has meant learning that has been decreased for our kids overall on a population level. It's varied by age, it's varied by the intensity of school, and it's varied by socioeconomic status. But what we know is that overall, kids' learning is declining, and that's particularly true for disadvantaged kids. There are threats to child survival and health. One of the really incredible things that we're seeing is an increase, a marked increase in mental health and social and emotional health issues for kids. So overall in the United States, emergency room visits for kids who are school-aged are up about 30%, 30%. And that is true in our community. And when you talk to Lakia and LJ and Jill, who see patients all the time, in our primary care practices, we're seeing a significant increase in the number of kids who are having mental health problems, 20 to 30% higher in primary care practices, in a background where that's already a big problem. And part of the reason is that they don't have the social supports associated with school. They don't have adults who in their lives who could help them with some of these problems. They don't have the social interactions with peers that sometimes can be so helpful in helping in these times of need. And then there are risks for child safety. What are we talking about there if we're not talking about safety in schools? Well, we're talking about the fact that kids are spending more time in unsupervised environments. We're talking about the fact that for some of our kids, home is a tough place to be, right? It's a challenging place to be. And they can be at risk for physical violence. They can be at risk for emotional violence. Schools are really important for our kids and families. So we want to say really clearly, and thank you, Mike Mendoza, thank you, Adam Bello, for saying this over and over again. Schools are not the source of rising infection rates. Dr. Mendoza, County Executive Bello, have talked repeatedly about the fact that almost all infections in our community in children have happened outside of schools. And when Dr. Fauci spoke in New York State earlier this week, he said, and I quote, "Keep the schools open is the best thing to do to help our kids and keep them safe during the time of this pandemic." And I'll turn it over to you, LJ.
Thanks, Jeff. So just a couple other points we wanted to make. You know, one of the questions that comes to us all the time in our practices and when we're talking with families and with schools is, what can we be doing to help keep our kids and families safe during this time of COVID? And we really appreciate this message that was translated and put into an infographic by the Rock the Future team. You know, it's really, the message is actually very straightforward and simple. It's do what the schools are doing. There are certain habits that represent a level of personal and social responsibility that make a difference. And it is masking, washing hands, keeping distance, and avoiding large groups. That's what's happening in school. That's why we're not seeing the transmission in schools that you would potentially see if you didn't have those very simple and straightforward measures in place. But these habits have to happen outside of school as well. So in community settings, in times where children may be coming together to play, in our own neighborhoods and homes and in our interactions with others. I know you've heard that message, but it's really, really true. Next slide. The other message we just want to give, and Jeff started off with this, is we are here to help. And we really want to make that commitment. And it's not just the 6 of us who are here on this call with you. So we really represent hundreds of healthcare providers concerned about children and adults. But with our pediatrician and family physician hats on, we're talking to you about children, but we're talking to you about the staff in the schools, the teachers, the staff, the administrators. We are concerned about the protection for all of them and making sure that they're safe. We've really had a wonderful number of conversations with the RCSD team and with the Rock the Future team. We're looking forward to opportunities, if there's interest, to talking with parents who have questions and concerns. We have had forums like that with some of the other schools who have opened for in-person school. And I think the thing I would say is we are all learning as we go in this, which is not always a reassuring thing to say to people, but we are learning, but we are actively learning, and we are modifying things, and we are looking and changing our procedures in a very timely and very unified fashion if things need to change. So I just want you to know you are in a community where all of the healthcare supports are working as closely together as they possibly can. It's something that I have never seen on this level before, even though in pediatrics, we've always been kind of one system of care. It's everybody working in that fashion and working in concert with our schools, with the school nurses, with the school physicians and nurse practitioners and PAs, with the teachers and administrators. Next slide. Just want to offer to you just a couple of points of things that have happened during the pandemic and in these collaborative type of efforts. Jeff showed the slide earlier that highlighted the very concerning headline about immunization rates dropping precipitously. So I just want to tell you this is something our community can be proud of. In this community, we have not seen a drop in immunization rates for children. And that is because right at the very beginning of the pandemic, all of the healthcare providers caring for children came together and determined a strategy by which we would assure that children's visits could be prioritized to make sure that we didn't have a second epidemic of pertussis or measles or any of these preventable infectious diseases. So we've done a nice job in keeping immunization rates up. Even with that though, many of you know that as our children went back into school, there were still children who were behind in vaccines. And so the practices across the region have come together to add additional visits, open their practices to patients who may not have an identified physician. And we've had the chance to work collaboratively with our great colleagues in school health and the school-based health centers who've been doing the same thing. They've been helping to catch up children who need immunizations or healthcare. So thank you to Lakia and her team and the other healthcare school-based health centers. We've worked closely with the Monroe County Department of Health on that work as well. And there's been a lot of collaboration right now around social emotional health. That's really a job that all of us own. We all have a responsibility, whether you're a parent or guardian, whether you're a pediatrician or a family physician, whether you're a psychologist or a social worker in the schools or in the community, and whether you're an educator or a school nurse, all of us have a responsibility to support the social emotional health of children. And we're working on better strategies for communication and for collaboration so that there's not such a long wait list for children, so that we're thinking about preventive types of things and social emotional promotional kinds of things we can be doing with children up front. The last thing I would just say is that as we have been able to do with the schools who have already gone into in-person education, our healthcare teams have worked really closely with the Monroe County Department of Health to be a resource for administrators, teachers, and nursing staff, and that is what we will do for our CSD. We will be there when you open to make sure that children have ready access for testing if it's needed, for healthcare assessment when it's needed, And it's not just during the pandemic, like Jeff said. This is an opportunity for us to do better for our shared kids, and we want to do that. And so we're open to your feedback and suggestions in that way. We have a couple of resources listed on here, just highlighting some of the work that's been done by the Rock the Future team on their site. And then also the Common Ground Health Finger Lakes Schools Reopening Safely Task Force has a wonderful page that's listed here with tons and tons of resources, everything from helping a child to learn to wear a mask to what kinds of things you can be doing to support your child's learning, to behavioral and social emotional resources. And I'm going to stop there, and we're going to stop screen sharing so we can see all your faces. And then I would just love to open it up to questions, and we'll sort of facilitate who answers, or many of us may answer your questions, but please let us know, how can we be helpful to you?
Before we do that, it would probably make a lot of sense if we have everybody introduce themselves. While some of us know a number of you, we want to make sure that the faces connect with the names. So I'll just start by saying my name is Van White. I'm a member of the Board of Education. Anybody?
Ben, you want to call on?
No, just go ahead and just, board members, everybody just sort of introduce themselves.
Cynthia Elliott, Vice President.
William Clark, member of the school board.
My name is Amy Malloy. I'm a teacher in the Brighton Central School District, as well as one of the board members here.
Good evening. I'm Willa Powell, one of the board members.
Beatrice LeBron, also a school board member.
Ricardo Adams, parent of 2 in the district and a school board member.
Good evening, I'm Shelley Jallo. Sorry for not appearing on screen, a little trouble with internet today, but thank you for your presentation.
And of course, you both know and have worked extensively with Dr. Nelms and Dr. Myers. All right, questions? Who wants to man the participant screen? Do you want to do that, LJ, or can you not do that? I can do it if not. All right, well, anybody have any questions or comments? I see Commissioner Malloy.
Yes, thank you. So it's more of a comment more than anything else. First and foremost, thank you so much for joining us this evening and providing us with this information. Definitely many of the questions that I had were answered with the presentation. Thank you for the work that your team continues to do for our community, for Monroe County. We're really grateful during this unprecedented time. So I just wanted to say thank you in advance. The comment I want to make is more as a perspective, or from the perspective of a teacher, right? In addition to, I have 4 children in the district, but I'm coming at this maybe from a teaching perspective. I think we all agree that kids should be in school, obviously. And as a teacher, I teach in both remote school or remote learning. I'm in charge of that, but as well as hybrid students. So I've kind of seen both. And some of the things that I'm noticing as an educator, so this is more an educational question, I'm noticing that my remote students are getting a lot more out of the teaching and the learning process than maybe my students are. So as an educator, I'd like to maybe separate the medical element regarding safety versus the value of the hybrid learning plans that we see out there right now. So hybrid learning only offers maybe 2 to 3 days of in-person instruction. And I guess my question, or what I'm trying to ponder at this point is it more effective than a fully remote model? And in terms of teaching and learning, what's the most effective model for us to go with? Because I want us to be really cautious moving forward, just in terms of this designation, because we know what the medical evidence is showing us, but at the same time, when we're concerned about students and whether or not there's more harm caused by them not being in school, is there also harm being caused by the instructional models that we're using for our students? So I guess I'm kind of coming at it from that angle, and I'm just wondering more than anything else. Thank you.
Commissioner Malloy, I really appreciate your question and your expertise in this area. So I think we recognize we're coming at this from a healthcare perspective. We're not educators. In medicine we are, but not in the schools. I think I would love to hear Jill Halterman and Lakia Wilson's thoughts about this, because you're caring for kids in the school district. And, you know, I think you have thoughts about this. Lakia, do you want to go?
I think it's a little bit too early for us to really tally, to say one model is better than the other. But anecdotally, from the patients that I see in my office and my telemedicine visits, one of the questions that I always ask about is, are you in school? Are you doing remote? Are you doing hybrid? How is that going? And I will say for the majority of my families, they are doing remote, and they are struggling. They are struggling either with internet access or finding a space that's quiet in the home where they can actually sit up at a desk and do their work. They have multiple siblings and they're all like sitting next to each other, interfering with the other's lessons or whatnot. And the families, the parents that I'm speaking to are saying that they're really struggling with their kids being remote 100% and being home and trying to help them with their studies, and saying they can't wait for the schools to open back up because they're not equipped to teach their children. And when I speak to the kids, you know, some of them love remote because they can be in their pajamas. My son was one of those who was in his robe every day until McQuaid opened back up and it's like, okay, you need to go back to school and wear your tie and what have you. But from what I'm getting from my patients, they're not as focused as if they were in the classroom. They tell me they could easily shut down their screen so that the teacher can't see exactly what they're doing, and they're not paying attention as much. And they're not learning as much as what I'm getting from them and their parents. And so I just wonder if like one model's better than the other. But I would say for my kids that are in the suburbs, it's a very different experience from my patients who live in the city. And I want to make sure that we make sure that the education is equal on both sides. And I know that my kids struggle and they have deficits, but I'm able to help them with it. But then I also wonder about my families that I serve. Do they have the same resources that I have? I don't know if you had anything else to add, Jill.
I would just agree with everything that you've said, is that we've seen lots of kids who seem to be really struggling and some who are completely falling through the cracks. And, you know, that plus the stress on families makes us very concerned that the disparities in education that already exist are getting worse. We also see kids who are just really missing the social interaction and experiencing depression and anxiety related to that. And then, as I mentioned, a few kids who are just completely falling through the cracks who basically haven't even logged in. So we're very, very concerned about those families. The parents seem exhausted to me because it's, you know, I think that if you compare fully engaged remote to a hybrid, it's possible, and I'm not an educator, so I don't know, but it's possible that there may be equivalents or one may be better than the other. I think the difficulty is that some of the kids who are remote learning are not able to be fully engaged for many reasons.
Anybody else from the team?
And if I could just add, I was seeing patients this morning, and I had a mom and her 3 kids in, and I saw 2 of the kids for their well child visits this morning. And one was 15, one was 12. And they both admitted to me they're fully remote in the city. They wanted to be back in school. They were sad. They missed their friends. They fully admitted to basically not engaging in their curriculum. And mom broke down in tears. She needed help. And, you know, I think it's important to think about the kids, but I think it's also important to think about our parents and the struggles that they're going through. You know, I think it will take a generation to unpack the damage that has been done by this pandemic. And, you know, and to Dr. Wilson's point, it's probably too early to know what the score is as to whether full remote versus hybrid is better or worse. But I think as you look to mitigate the collateral damage, I think in the balance of things, being in person some of the time is far more important than any potential shortcomings that might come from being in a hybrid learning environment. I think that social interaction cannot be underestimated.
I would agree with that. The last thing I was going to add is just when you think, I just had a meeting with about 100 community practitioners, and we unmuted people and they talked about what they were seeing in their practices. And I mean, there were practically tears on that call, people talking about, as Jeff alluded to earlier, that pretty much most of their practice time is spent now dealing with not only anxiety, which is what we saw early in the pandemic. There was a lot of anxiety and confusion and distress, but now the social emotional issues are far more concerning. There's significant depression, there's suicidality. There are children who they just don't have a connection or an outlet, and you can't see that. You can't connect around that on Zoom. And, you know, our providers are saying that they're basically testing for COVID, but 80% of the time in some cases, that's what they are doing right now is significant behavioral and emotional health support.
And I can echo with that as well, LJ, because with my subspecialty as adolescent medicine, I see a lot of anxiety and depression, and my slots fill up so quickly. I'm getting referrals from in our practice and outside of our practice of individuals with severe depression and anxiety, not able to participate in remote. The parents are asking, how do I motivate my child? They've lost their social internet actions, and then they take away privileges, thinking that's a way to motivate their children, but then their kids give up completely, and they're in the bed all day, and the parents are like crying, help me, how do I help my child?
I have a number of board members who have questions, and the participant list is providing the names in this order: Commissioner Clark, Commissioner Adams, Commissioner LeBron, and Commissioner Powell. Commissioner Clark.
Thank you, President White. I want to start by saying this was a great presentation, and I wish there was a way that we could get this out to the entire community. I know you're doing a lot, but I think more parents need to hear this, and more of the community needs to be aware, because one of my concerns, and I think one of the doctors talked about it also, is the fact that I do believe there's a learning loss, particularly in the inner city, where internet access is not as accessible. I mean, I live in an area of the city where just about every day my internet goes down, and it's frustrating. So I know it's got to be very frustrating for the students that are out there. And also knowing that many of the colleges, area colleges, as soon as they could, went to a hybrid model. I really would like to see more information also on hybrid versus a full remote model. But the one concern I have is there's a lot of misinformation that's coming out in the media, particularly I could refer to the articles coming out in Florida from the analysts indicating that the cases are understated. And I think it kind of undermines the message that we're trying to get to the community regarding getting our children back in school, but getting our children in a safe environment.
I would definitely agree with your statement there. Comments from the team? Brenda, I see you're nodding, or Jeff.
Yeah, I couldn't agree more with the comments about misinformation and you know, how do we better communicate the facts and combat some of that. So I do like looking to things like hospitalizations. You can't really undercount that. You know, that's a real hard fact. We know certainly people presenting for medical care now are getting tested for COVID. So we have a much better understanding of, you know, among people that are presenting for care, presenting sick, you know, how many of them have COVID. So I think that's one factual way to try and get out.
And to your point, Commissioner Clark, I would turn this around and say that this is an opportunity. You know, for all of the misinformation that you may be hearing from national or even statewide media, I think this is an opportunity for us on this call, for the leaders on this call to unify and share that single, accurate, data-driven message. I think that is something that we owe to our community. You know, the way you fight fear is through facts and understanding and listening and support. And I think this is an opportunity for us to do that together. And what I worry about is that our kids in our city have been denied that opportunity. And that's because of our inaction as adults. We owe it to our kids to work together. And I think it's an opportunity now to do that. We have a window of opportunity to do that. And nobody knows what's going to happen in January, February, and March with this as the vaccine rolls out and all of the, surge, happens. But I think we have a window of opportunity where we could work together to correct those misperceptions.
I'll just add one quick thing, which is that Superintendent Myers-Small and Superintendent Nelms have talked with us about presenting to parents and teachers. We would be really happy to do it. We would be really happy to do that. They wanted us to have the chance to talk with you first, but I think Commissioner Clark, you're exactly right. We should be telling the truth, and we should be trying to do better to communicate with our parents and teachers too. Rock the Future has helped us a lot with that. Rock the Future has been terrific in terms of helping us to talk with and message with parents, but we need to do more.
Thank you. Commissioner Adams?
So talking about facts is a good place for me to start, because the fact is, listening to you today, when young kids get it, it's the exception to the rule. It's the exception to the rule. Only 10 have been hospitalized since it started, but we're not giving that message that it's the exception to the rule. There's a lot of messages going out. There's putting a lot of fear out here. So I'm wondering if we should try maybe let the kids go in, maybe have the teachers teaching from a screen. Maybe don't have them in the room, because we're as adults, we're bringing, but let the kids be in there together, because they're not infecting each other. And I don't mean just the city kids, because I go hiking and everything, and I see the young kids everywhere. The young white kids not masking up, and the young black kids not masking up. And I don't see the increases in the numbers, but the numbers for the adults, it's 678 today. So I know there's no doctor gonna say anything is absolute. That's a concern. But the fact is, it's the exception to the rule when a kid actually gets COVID. It really is. And we need to start from there and being a little more honest, being a little more brave, because kids are being victimized. They're being victimized with depression, anxiety, and just for being in their parents' face all day. Even that. So I don't know. I don't really have a question, but I as a parent, if my kids really want to go back, but I have to try to not, I don't know. It's just bad. I just had to say what I had to say. And with that, I'm clear.
Thank you, Commissioner Adams. Commissioner LeBron?
Yeah, I just want to say I love Mr. Adams. So thank you for that, Mr. Adams. So I have just a couple of thoughts and points that I want to point out. One, I don't want to dismiss the fear that parents have if their child is at risk or does get COVID, because I said this at a board meeting before, and I'll repeat it again. We still do not know the long-term health implications on COVID in children. We have no idea. There's no data points for that yet. So I get it. And as I'm a mother too in this district, and as a grandmother too, I worry, like, I don't want to infect my 18-month-old if I get COVID and if I'm exposed somewhere. But I do want to recognize that there is no perfect model in a pandemic. Whether we're hybrid or we're virtual, it does not mean that we are back to, it just doesn't equate to what we traditionally know as 5 days a week, all day in school, and that social emotional piece. So I do want to acknowledge that I think schools are doing the best that they can with the resources that they have and at that current moment. And yes, as we learn more and we feel more resourceful and a little bit better position to then transition as we are now into the hybrid model. This was something I was struggling with as a parent, whether I would send my child back or not into this hybrid model or keep her remote, understanding that hybrid meant only 2 days a week in person, 3 days on her own. Right now, Wednesdays, she's on her own anyway in terms of learning. But I want to highlight the social emotional piece of it and what has really determined our decision in this household. I have a 9-year-old who I felt was, she's extremely social and very sassy, and we joke about her large personality all the time, and anybody that knows her knows that she's just that really upbeat, bubbly, funny child. And my child experienced both depression and anxiety. And me as the adult, it took me a little bit to recognize, even knowing right about depression and anxiety and working in the health field myself, knowing that that was occurring. I just didn't even think it was possible. And part of it was that I was caught up as the adult, right, and all my own responsibilities of having to figure out how do I work from home and still complete home visits and provide social emotional help to the population at the time that I was serving, which was senior citizens during this pandemic, and, you know, worrying about their service plans and getting them connected to resources that, in the midst of all that, right? And life happening, because life was still happening around us. We moved, I lost, you know, a sister, which is an aunt to my daughter. We experienced death, we experienced move. And it hit me like a ton of bricks when I recognized that my daughter, who started off by being a little bit defiant here and there on things that she normally would not be defiant on. And I was, you know, kind of like, okay, you're gonna listen and we're gonna keep things moving. But it took like a real serious thing that occurred in my house for me to wake up and realize that my daughter's whole entire world changed on March 15th, right? School was shut down. So now she no longer had school to interact with peers. She no longer had her after school program. Dance was shut down. She didn't have those outlets to have those friendships and in ways that I cannot provide those social emotional supports to her as an adult. And it was a slap in the face. And so just having those conversations with my 9-year-old, just recognizing that we are going to move forward and do the hybrid model, to give her that opportunity to be around some peers more than anything. And that it means for me that I'm gonna have to step up and ensure like those 3 days that she is doing and submitting the work that is being uploaded for her and giving her those supports at home. But it is not an easy decision for parents, and I wanna uplift that and highlight that and let other parents know that whatever you decide to do, I wanna value and respect that. And you know your children best and your home life circumstances best. And however I can support, I will support. But I just want to really uplift that social emotional piece into these models. And this is what we have, and this is the best that we have at this time. Thank you. And thank you guys for coming and presenting today.
Commissioner LeBron, I cannot thank you enough for sharing your personal story in that. And you saw all of us nodding, and I think feeling a tremendous amount of empathy and concern for you, for your family, for your daughter. You're sharing that is, I think many people on this call, many of us could share similar things about our children and the children that we care for. I want to just reiterate one thing that you said. We absolutely want to be present with parents in their concern and their worry and their anxiety and their fear, and absolutely would not want to minimize that at all. We all feel that. And there are children who get COVID infection. Fortunately, they just don't seem to get the same level of disease and illness that the adults do, but they do get sick and they require, you know, care at home. And there's that question of what might happen. And so again, the pediatricians and family physicians in the community take that responsibility very seriously to assess those children, to make sure that they're okay. And again, we want to state that we will do everything we can as a team to make those assessments even easier, partnering with the school nurses, with the school-based health centers, so that for the children who do come back in school, we can make sure that those happen readily, so that we're not letting barriers of transportation or hours of office being open when parents are working. We're going to break down those barriers and figure out better paths for serving these kids. Thank you for your comments.
Commissioner Powell.
Thank you. Can you hear me okay?
Mhm.
So I do have a question at the end of this, but the question is for the superintendent. Let me start by saying that my husband teaches at the college level, and he lists Dr. Mendoza as his primary care physician. But he has said that in no uncertain terms that he would not teach an in-person class because of his, health, compromised health. But he's also said that his students at the college level are achieving the same level they did with in-person class. And I have a junior in high school sitting right next to me who has said similar things, that his own achievement does not seem to have suffered, except for the fact that he's a theater major, and how do you actually study theater without getting on a stage and putting on a performance? I'm not sure how that works. And I recognize that that's a high school experience with a well-grounded individual, similar to perhaps to Amy's experience with Amy's Commissioner Malloy's students. The older they are, the more skills they have to cope with remote learning. And I think about the kids at the younger end of the spectrum, and oh, how hard it must be for them to sit in front of a computer monitor all day and navigate the screen. And I have a grandchild who is a kindergartner. Her mom is working from home, so is able to sit and do her work right next to my grandson. And although it is stressful, and she's done it, she's managed it for a while with a nursing 9-month-old. And so I say all that to say that I only know the experience of folks who have adapted well, who have resources, right? Who have the parenting skills to keep their children focused, whose children are well motivated and able. And so I have, at this stage in my life, not to say that I haven't struggled with my kids when they were younger, but at this stage in my life, I have no experiences with direct experience with those who are struggling in the way you describe. So I'm totally open to what superintendent chooses to propose for reopening schools. But I also realize that while the children may not be getting infected, schools become part of the chain of transmission. And I don't want for our teachers to become sick because children brought illness from their homes to their teachers, and vice versa. I don't want our teachers to inadvertently be the pathway by which, from teacher to student and into people's homes, for that to be the source of spread in our community. I mean, we're a long time dead, folks, and I think about however long this pandemic has ripple effects through our community, folks are a long time dead, and I don't want to see any of our community taken down by this. So with that kind of background of what's been going on in my head, I have one other observation. A former neighbor moved to East Rochester, and their child goes to school 4 days a week on a half-day basis. Maybe someone from your team could describe what the rationale around that might be, and why that would be better than or not better than the hybrid model that superintendent is pitching. That's one question. Next question is, we have a huge number of families have not responded to the question, do you want to continue with remote learning versus in-person hybrid learning, And I wonder what suggestions you have to help us reach those families that haven't responded. And my third question, and I'm figuring different people are going to be answering different parts of this. My third question is to the superintendent. Given the low numbers of respondents that are choosing the hybrid in-person learning, would it be possible, given the low numbers of students, to expand that into 4 days a week with one asynchronous day? Or is the real barrier the financial barrier of having fewer children per teacher? Is that the real barrier to us being able to expand in-person learning to the fullest extent possible? And I did have one other thought flit through my mind, but hopefully we'll have another round to ask.
I wonder if we, oh, I'm so sorry. I was going to say, I wonder if we might start to answer a couple of those questions that you posed. Is that okay?
Before you do that, LJ, I
Yeah.
just want to remind folks, it would be great to have several rounds, but I did want to remind folks that we had a stop. I suppose we could go beyond at 6:30. So I just wanted folks to be mindful in their responses and also know that there are 2 other board members that have questions. But if folks want to continue, they can. But please, in your responses, be mindful that we ask our guests to stay until 6:30. Thank you.
Thank you so much for that.
Yeah,
There are some of, Jeff, would you like to start first?
Trying
And
to
then,
answer fast, I'll say 2 things really quickly. One is in a national look at childcare providers, teachers in childcare, they looked at teachers who were actually participating and working in childcare centers and teachers who weren't, where the childcare centers had closed. And on a national level, they found no more increase in terms of those teachers' infections for those who are actually working with the kids every day versus those who weren't. So it seems like school and childcare can be a very safe environment. And the one thing, Commissioner Powell, really appreciate your story about your family and your considerations. One thing that I want to point out with Dr. Jallo here is, you know, your pre-K programs are superb, world-class, the best measured in the United States. And there's just no way that kids are going to get a world-class pre-K experience through virtual learning. I'll turn it over to Jill or Brenda.
I was just going to mention very quickly that regarding the concern for teachers and staff, we had the same concern in our primary care practice. And to be honest, in the beginning of the pandemic, we were all kind of scared and we didn't know quite how to handle it. We stopped a lot of our visits that weren't absolutely essential and slowed everything down. And I can tell you that over time, we have been able to come back up to full capacity in our practice. We've been able to keep our staff safe. And I'm responsible not only for the children that we see in the practice, but also for the staff that work there. And that includes the providers as well as the nurses and the secretaries and the environmental services workers and everybody who's there with us. We use appropriate precautions, we use masks, and we've been able to keep the team safe. So we've been really proud of that. We have kids in the practice all day long. And we found that the kids will wear their masks, they'll keep them on. They occasionally need reminders, which has worked just fine. We have had some staff who've gotten COVID, but it hasn't been in the practice. It's been in their own communities, unfortunately. But when they're working with us, they're able to stay safe.
thank you, Jill. Brenda, do you have anything you want to add to that?
Yeah, I think that really covers it. We have lots of lessons from healthcare settings and other school and child care settings that we can help the school district adapt to your schools.
And I just wanted to add that I think the latest infection rate in the schools in Monroe County is 0.018%. If I'm saying that correctly, Dr. Mendoza, correct me if I'm not right about that.
You're muted, Dr. Mendoza.
Yes, that's correct. It's 0.18%, yes.
So that, I think that's a really key point, because I heard that concern come from you, Commissioner Powell, about, spreading infection in schools or to teachers, that it really is not, because of the same thing we talked in the beginning, because they're using the infection prevention measures, just hand washing, distance, and masks. And even though it is a group of people together, when you follow those rules in a group of people together, it works. It's protective. So I think we can state with confidence that that level of spread is not being seen, even with the surge that's happening in our community.
Vice President Elliott.
Well, it's after 6:30. Do we want to continue? Can our guests continue?
I think if we can get some quick questions out and maybe some quick responses, and if it's necessary, I'm sure our guests would maybe come back, at least one or two of them, but I'd like for at least every board member who hasn't had a chance to ask a question to do that. And Vice President Elliott, I don't think you've had a chance, so why don't you go ahead? If our guests don't mind going over just a little bit.
Okay.
I see a couple of thumbs up, so why don't you go ahead?
So my concern is, you all talk about, well, let me first of all start off by really acknowledging and welcoming you to our board meeting, first of all. Secondly, Dr. Mendoza, I just appreciate your work. You provide me with a lot of confidence on a personal level. With you and the county executive and with the governor, New York State is in great hands, and I want to thank you for that. And Dr. Jeff, let me just say that I know you've been around in our community for a very long time, working on behalf of children in our community. So I really do commend you for that. The other three ladies, I don't know, but welcome. So I'll start off by saying that. But let me also say, I'm hearing about, the data that is out there when it comes to, Monroe County and our schools on a national level, on a county level. My concern is there specific data when it comes to urban education? Because we tend to group all of this together, and it marginalizes African-American children and Hispanic children. And so is there specific data out there that speaks to what you're saying, that the infection rates are the lowest in Black schools or schools where there's a majority Black and Hispanic population? That's what I'd like to know. And have you done that kind of research? If that kind of research is out there, and if so, what does that research say, if you know? And I'm a little sensitive about it because I just participated. I just was on a lecture with Harriet Washington. If you're familiar with Harriet Washington, she wrote the book Medical Apartheid. So there is skepticism in the African American community when it comes to healthcare. And we all know some of the popular studies, but there are far more studies that are in fact the kind of medical care that has had a negative impact on our community. And so I'd like to be able to know, if that research is available, number one, and number two, I just believe that it is going to be difficult to get the African-American community, to get most of the African-American community to participate in getting vaccinations. Because of the history. I'm not getting it. I'll just put it on the line. I'm not going to take the shot. So there are a lot of there are African Americans who've got the history. So how do you address, and let me just say this, because what we tend to do in this community, and Dr. Mendoza, I'm going to have to pick on you for a minute respectfully. I remember that Dr. Mendoza presented at a Council of Agency executive meetings, and he had a slide, but the issue of racism was to the side. It was not in the core of the issues that the clients of that group affected. And so we sort of marginalize when it comes to race. We don't put it in the center, and particularly when we know in Rochester, we are disproportionately affected by poverty as it relates to race. And so we don't seem to put that at the forefront like we should. It just seems as if we have not been intelligent about that in order to be able to address it. And it wasn't until Black Lives Matter came out that we really began to put that in focus. And we should have been putting it in focus all along, because there have been so many people over 40 years or so been talking about issues of race. So the two questions again is with regard to research that is specific to urban schools that have a predominantly African-American Hispanic population. Have you all looked into that? Is there data available for that? And just in terms of the African-American population being resistant to getting the vaccine. Thank you.
So Vice President Elliott, I participated in that session with Harriet Washington the other day and was invited to submit some questions ahead of time for her. That was an unbelievable and horrible, it was just horrific to listen to the stories about how racism has impacted the health community over time. And I wholeheartedly agree with you on the fact that we have so much to continue to address in the Rochester community on racism. And I can share with you a slide and share with the board, with your permission, a slide and follow up. We do have data from Yonkers and Syracuse, which have reopened in New York State in terms of infection rates. And we're happy to report that the infection rates for kids have stayed very low there. In fact, they're better than some of our suburban districts. There are other folks who may have other data, but I do have that local data thanks to work with Rock the Future and some of the school communities in Syracuse and Yonkers that I'd be happy to share with you afterwards in a follow-up slide or email.
Thank you.
Given how important of an issue that was, I don't know if anybody else wanted to address that. If not, I know Commissioner Adams had a follow-up, and so did Commissioner Malloy.
I just wanted to say to Commissioner Elliott, we are very aware of how racism has affected medicine, how we have been trained, how we treat our patients, how there's differences, how we make assumptions based on color or where our patients live and whatnot. And we are making a very conscious effort to change that, whether that is recruiting more people of color to serve our community so that the providers that are providing the care also represent the community that they're serving. We are also making sure that we listen to our patients more versus prescribing this and prescribing that, and understanding why a family is hesitant to get any type of vaccine from us. So we do have dialogues with our families to meet them where they're at, to understand all of that background history of mistrusting the medical community. We do not force our patients to do anything that, against what they would like to do or what we would recommend. And we do take the time to understand, but we also provide the evidence supporting vaccines, but then at the same time understanding why our families may not trust the medical community. And we work very hard to improve our relationships in the community. And I can speak of, for the docs that are on this call, that we're out in the community. We're trying to make a difference. We're trying to get out of that box of we only serve this and do that, that we want to be known as those docs in the community that care for everyone equally and respectively.
Lakia, thank you for that. We must do better. That it's an embarrassment. I think we feel ashamed when we look at the history of how of not doing a good job in this at all. And I support everything that Lakia said. We will do better, and we must in that space. So thank you so much for bringing that to our attention. I know there were a couple of follow-up questions. I have to apologize to the group on the call. I actually am responsible for doing another presentation right now in a different Zoom room somewhere. And I think they're waiting for me to come to that. But the rest of the team, I believe, I don't know if anybody else has the same issue, but if they can stay on for a few more minutes, you've got the core team here to be able to answer questions. Thank you. It has been an honor to talk with you tonight, and I apologize for having to step away. Thank you very much.
Thank
No
you,
need.
Dr. Shipley.
Yes, no need to apologize. We appreciate every minute of your time and understand that you have other obligations. I would ask my colleagues to be mindful that the folks who have generously decided to stay on, that they too probably have other commitments, so that if you could be brief in your questions and comments, that would be appreciated. Commissioner Adams and Commissioner Malloy.
And I want to apologize as well. I've got to get going as well. Thank you all very much.
Okay, and Dr. Mendoza was one of the questions. I know I'm not going to get an answer, but I have to say, I asked you, what would you recommend in reference to us opening or closing the school? Can I get a recommendation from you?
I recommend that you open your schools.
Okay. All right. All right.
Thank you.
Okay, and because you're the Fauci of Monroe County.
But we should have a conversation about it, because it's not as though there's a zero risk path through this. You know,
Yes.
there are consequences either way we go. But in the balance of what we're looking at, I think far and away we ought to be working to reopen schools.
Okay, and the other question is, and you can go, is that with the testing going on, are we doing contact tracing? When we do contact tracing, are we finding out their contact with kids? Because all these people are testing positive. Ain't no kids in the house, because the numbers are not right. I just believe we can get a lot more information if we, with this tracing, if we find out are there kids around, and then we try follow those kids. That's all. I'm done.
That's a great question. Thank you. I'm going to take over from moderating since Dr. Shipley had to sign off, but I'm wondering if Dr. Tassini could help with that one.
Yeah, sure. That information is definitely taken with contact tracing. So I've been a part of some of the contact tracing calls with Dr. Mendoza's office. And yeah, they definitely take a list of everyone who's in the house and anyone that people have come in contact with for the 2 days before they got infected, and talk about those interactions to really figure out who's been impacted, who's been infected. And really what we're seeing is that kids do not really have symptomatic infection to the level that adults do. But then also things that we've done, like right here in Monroe County, New York City schools, and many places is, even surveying kids, testing them who don't have symptoms of infection. Kids who are in school settings still have lower rates of even asymptomatic infection.
Thank you. Commissioner Malloy.
Right, I'll make this really quick. Just anecdotally speaking, I have 4 children in the district, ages 8 through 16. So I have 2 elementary age students, 1 middle schooler, and then a junior in high school. My high schooler is doing just fine, right? No problem with the remote learning. And I realize that every student is different, but I know that my middle schooler is really struggling, as well as, my 2 elementary age kids with the remote learning at this point. Have you noticed in your practices, just in terms of the social emotional components that you've talked about, are you noticing maybe a preponderance of that kids at a certain age group experiencing depression, et cetera, versus our high school age students? And I'm wondering if anyone could speak medically to that for me. Thank you.
I could go ahead and answer that. So as I mentioned, I also do adolescent medicine. I will say that the referrals that I'm getting initially were older adolescents. Now I'm getting the younger adolescents. I'm getting a whole slew of like 12 and 13-year-olds that are presenting with anxiety or depression. Or what they often bring the kids in for is, they spend all this time in front of the Xbox and won't come down to eat, they're losing weight and what have you. And when I tease things out of what's actually going on, a lot of it is anxiety. The other piece is that they lost all their social interaction, right? So they're limited on how much electronics they can play, but when they're online, they're actually socializing with their peers. And so what I've been counseling my parents on is that you've got to find this balance, right? Because before we're like only 2 hours of non-related electronics to non-related to school electronics. But then I was also realizing in practice and in speaking to my families that the kids actually needed that social interaction with their peers online, and it was actually helping them. So yes, I have seen an increase in that exact age group that you're talking about, whether it's not wanting to go to bed, whether it's presenting with stomach aches and they're not sure why they're having the stomach aches, the fear, because I had a 14-year-old that was in tears because her mother tested positive and she needed to get tested. And she said to me, what if I have it? What if I'm going to die? What if I'm never going to be able to leave my house again? And so then I spent the time talking about what COVID is and what the infection is typically like in children, and then about what her mother's symptoms were, to just kind of reiterate, the natural history of COVID with my family. So yes, I've seen a lot of anxiety, depression, and that social isolation in that age group that you're talking about.
And I'll just add, the other thing that we're seeing a lot of is sleep disruption. So kids who are not following any routine sleep schedule whatsoever because of the disconnect with not having in-person school.
More so with younger students versus the older students, or is it kind of equal across the board?
I think we're seeing it in all ages, to be honest.
I'll just add one thing personally, which is for our kids, even with 2 of us as pediatricians in the household, most important person in my daughter's life, the person who helps her the most, is a coach for her in soccer. And she denied that at the beginning of the year, really struggled. And then luckily we were able to have her come back and play sports, and she got to interact with her coach. And it was incredible. And I'm sure for many of our kids, their teachers and paraprofessionals and coaches and people who are working with them on a daily basis at the school are so important for their mental health and their well-being.
Thank you so much.
And then I just wanted to add, the sleep disturbances is a huge piece that we're seeing, but also the irritability and the fluctuation in mood. That is another sign of either anxiety or depression in your youth that adults may not present as much as the youth do.
I want to thank everyone who participated today. Jeff, Lakia, Brenda, and Jill. Please share the Board of Education and Dr. Nelms and Dr. Myers. Thanks for sharing your time today. Also, and more importantly, we want to, on behalf of the whole community, want to thank you for the critical care that you're providing to our citizens, our children, and our families. And finally, it should not go unspoken that we really appreciate the fact that you are quite regularly putting yourselves in harm's way for the benefit of the entire community. And for that, you have our true appreciation. We hope that this conversation can continue sometime in the future. Obviously, we did not have enough time to ask all the questions and perhaps provide some of the thoughts that we might have on the subject ourselves. But and so finally, I would ask on behalf of the board and Superintendent Nelms and Myers that you be willing to continue this relationship. I think this is very positive. I've been on the board for 12, 13 years, and I can't recall ever having this kind of productive, fact-based conversation about the health and care of our students and our families. So again, on behalf of the board, Dr. Myers and Dr. Nelms and Dr. Jallow, thank you very much for coming tonight.
Thank you so much for having us. We really appreciate it.
All right, we have some other business to take care of, and I'm sure you all do too. So we're just going to stay here in the Zoom room, and we would just say good night to you all.
Good night.
Good night.
Thank you.
Thank you.
Thanks again.
Good
Okay.
to see you, Jeff.
Okay, we got one more bit of business on the agenda for tonight, and that is the discussion of.
Van?
Yes.
Before we move on from this topic, I wonder if the superintendent could talk a little bit about my question about what are the limitations on the hybrid returning to school in a hybrid situation. I realize that no matter what, there's going to be a lot of shuffling around. A lot of kids are going to have different teachers if they choose the hybrid versus the totally remote. What do you think about 4-day-a-week return for, given how small a number of families are choosing to come back? Is it possible we can have them, 4-day-a-week instead of 2 for one group and 2 for another?
Well, a couple of things. Remember, we are doing 4 days a week for our students in specialized services. So that starts right after the first of the year. I think what complicates, doesn't make it impossible, but then we would need to re-ask every single parent and caregiver what their choice would be. We surveyed based on the 2 days in person and 3 days asynchronous. So I think that would cause a little bit of confusion if we said, okay, now we're switching kind of right with the deadline being tomorrow. I don't think we're adverse to it. I'm certainly not adverse to it, but again, timing.
Well, and the reason I ask is primarily because of how low the numbers were when you reported it out, that it seemed to present an opportunity that might not have existed if 50% of our families chose the remote option, or more than 50%. So that's part of what provoked the question. But I do wonder if limitations on class size would also make it financially impossible to try any other model.
I think, the key thing is that we have to remember that we have to adhere to CDC guidelines. So we have fluctuations. I think it would be difficult because you do have, once we look at this, we're going to have variability as far as the percentage and numbers that are coming back by school. So some schools are going to be lower than others. So it might work for schools that have lower numbers, but schools that have higher numbers, we can't do the full 4, wouldn't be able to do the 4 days. So I think that's what complicates it. And then it just goes back to what I've said from the very beginning of, this is what makes our district unique when it comes to reopening because of our size. And so trying to juggle all of this, again, we have so many schools, so many classrooms, take out the schools, so many classrooms that we're dealing with, to try and figure out that variability where there might be a lower number. You have your average, which means you have lower and higher than that. I think you'd have some schools that would be able to offer the 4 days where others we would not, because of adhering to CDC guidelines.
Thank you.
Mm-hmm. And before President White comes on, I do just want to remind individuals that, and I want to thank the physicians, our medical doctors again, but they are willing to come back and do focus groups. Vice President Elliott, we have been having those conversations about the mistrust and distrust that exists in Black and Brown communities as it relates to healthcare. And I think you heard very genuinely from them. They really want to listen to our community. So we're going to look at coming back in January to do some focus groups and interactions with those physicians, with our teachers, and with our parents and caregivers, because they want to have that conversation.
All right. Thank you.
Mm-hmm. Thank you, President White.
Yes, Dr. Myers. Leslie, you did you record something on DKX today to? Do you want
Sorry, I did.
A board update on that?
Sure. So this morning, I did an interview with Tariq on WDKX, just reminding families that they need to respond and just let us know, just either way, is it hybrid or is it remote? And they're going to be playing that throughout the day and again tomorrow. I want to thank WDKX for being very generous with allowing me to come on and to have those conversations and to support our district in that way. But they too are concerned, and they just want to make sure that our parents are reached. And we know that a lot of our families do listen to the radio, and that's a source of information. And that really is for the parents and caregivers. For some reason, we don't have their contact information, whether it's a cell or email, because that's why we're not getting some responses. So that we were just trying to maximize our venues to reach out to parents. Thank you.
Any other questions on that subject? Comments? All right. Next item on the agenda is the board's proposed cuts to the 2021 budget. As you all know, the Board of Education maintains, this is more for folks just watching, the board maintains its own department within the district. And so consistent with the superintendent's request for 20% reduction from every department, on August 27th, I proposed, with the help of staff, a series of cuts that would amount to a 20% reduction. As you all know, we discussed that on at least one other occasion, one of those dates being August 27th. There didn't appear to be any consensus. It's not there was widespread disagreement, but clearly was no consensus. I encourage you all to look at the proposal and offer any additional input. I had not gotten any. We sent out another letter, email yesterday, asking that if anybody had any suggestions about further cuts or maybe even additions, because we couldn't tolerate cuts, additional cuts, that you offer those as well. And as of this evening, I had not gotten any, staff hadn't gotten any. The total amount of the cuts would be, thank you, Kalia, for showing that, is $286,000. That amounts to 20%. Rather than going into a lot of detail, the email is there for you to review. It is important that we move this subject along. The superintendent has been telling us for quite some time that she needed a 20% cut. I think at an officers meeting about a week or so ago, she said, hey, listen, I got to get your number from you. And so that's why I brought this subject up again. I don't, there is no more time to put this off for another conversation. This is the time, as they used to say, to fish or cut bait. If you have any suggestions, speak now or forever hold your peace. So let me turn on the participant screen and see what we got in terms of comments. All right, I see Commissioner LeBron. Commissioner LeBron?
Yeah, so I just want to again reiterate that presenting a budget with cuts that were already made at the end of last budget cycle to start July 1 is not a true reflection of cuts for a budget that's going to start July 1 in 2021. And so this does not represent a true reflection of 20%. We already cut the claims auditors. Those numbers should not be reflected in this, and it should be a true representation of 20%. And I don't want the community to have this belief that we are actually cutting 20% of our budget when we already made these cuts. These cuts already happened, you guys. So I said this before, you're presenting the exact same thing you presented. And I just want to note, 24 hours is not enough notice. If you found out about it or had this discussion in the leadership meeting with the superintendent a week ago, immediately after that meeting, that was the time to say, this is going to be back on the agenda, because this meeting wasn't even scheduled for today. This meeting just popped up on my calendar, and I have all the meetings on my personal calendar. This one just popped up on my district calendar. And I ended up accepting this meeting today. I didn't even know what this meeting was about today. And all it said was that it was going to be a discussion with the doctors. So again, if we are serious about making cuts and as board members being conscious to keep those cuts as minimal as possible directly to schools, then we need to be serious about looking at our entire budget and making real cuts in our budget so that our schools then don't have to eat those cuts.
I see Commissioner Malloy. I'll respond to those comments, but I want to make sure everybody has a chance to offer up their comments first. Commissioner Malloy.
I'll just say this, and although I haven't advocated for this privately with the group. You know, if we're talking about the need for 20% in cuts, I think perhaps we should be looking at our own salaries as commissioners as well and consider cutting 20% of our own personal salaries. Although that won't add up to much, I think the gesture would be important.
Okay, I don't see, I'm looking at the participant list, so I'm not looking at the Brady Bunch screen. So I don't see anybody else raising their hand. Let me note in the first instance, this proposal, this very proposal has been before you all since August 27th. When that proposal was brought to your attention, at that time, I said, anybody have any comments or suggestions, please offer them at that time. I never got any specific counter proposals. It's one thing to say, hey, listen, you know, the numbers aren't right. It's not truly 20%, but it's another thing to come up with another area. For example, Commissioner Malloy just said, how about 20% off our salaries? We cannot, again, let me repeat, this proposal, this written proposal has been before you all since August of 2020. That's several months. And I've never gotten, including when it was resent yesterday, I've never gotten a counter proposal. Now let me just address this issue of, well, you know, this isn't really a cut. Now I know Commissioner LeBron is telling people that it's not truly a cut, but this issue has been litigated, if you will, before. We went to finance, and there's no need to go back and forth about this because we've had this conversation before. You all, I know Commissioner Clark, you weren't around, but we've had this conversation before. We went to budget. Budget has indicated that the money that is being reduced, proposed to be reduced, was allocated for the 2021 budget. This money that is proposed to be cut is money that was allocated for this year's budget. We were talking about, for your benefit, Commissioner Clark, we've been talking about for at least 3 years, cutting back what's called our claims audit department. Previously, we had people working there doing the claims audit function, right? And for years, people have been talking about, going back, I think, to superintendents, have been talking about cutting that department. Those conversations got a little more tense over the last, you know, let's say 9 months or so, and before the 2021 budget was in place. And the thought was, yeah, you know, we really should hire out a private firm. And Commissioner Clark, you have seen that private firm, Naraki. We decided ultimately to replace them. But let me repeat, the demand, or the request, I should say, from the superintendent is to look at your 2021 budget and reduce it by 20%. The dollar amounts referred to in the sheet that you all have had, the numbers that have been there on your desk, except Commissioner Clark, since August 27th, are numbers from the 2021 budget. And every board member, with the exception of you, Mr. Clark, has heard the conversation before, and it has been confirmed by staff, including our prior clerk, that this money was set aside for the 2021 budget. Our decision now, if that's a decision that folks make, to reduce that amount would be a reduction of the money that was allocated for the year that we're presently in. Now, let me say, if someone has another idea, including Commissioner Malloy, who raises one right now, that's fine. But the question is, at the very least, September, October, November, it has been 3 months. And now the superintendent, just with respect to what she said to me the other day, it came up in an officers meeting where I think Vice President Elliott was present, and she simply said, and by the way, you all know, I've said at public meetings, superintendent, let us know when we have to make decisions, because she hadn't made the final decisions on her cuts. This isn't the first time I've said this. And I think she said at a recent officers meeting, now is the time, President White, we need to make these cuts. But let me repeat, this is not the first time this subject or this proposal has been put before people. It has been before these colleagues for at least 3 months. And again, I'm just trying to provide a number that meets the superintendent's requirements of 20%. If somebody has another idea, Now is the time, actually not now, yesterday, a month ago, 2 months ago, 3 months ago was the time to do it because our superintendent has been saying to us, and we have had a proposal on the table for 2.5 months. Now is the time we have to make a decision on that proposal because the superintendent needs to get all her departments together, all of them hopefully with around 20%, and present these cuts so that we can ensure the long-term future and stability of this district. Let me go back to the participant list. I believe I saw Commissioner LeBron had raised her hand. Commissioner LeBron?
Yeah, I do want to respond. So yes, August 27th, we had this debate. We also, which I will share publicly after this meeting, I'm going to go pull up all those emails where we went back and forth and had this debate. And there were suggestions in that email too. You want to make a true reflection, a cut, it cannot be the claims auditor. Again, that conversation happened in May 2019 for a July 1, 2019 budget start. So those decisions to move forward and cut, those already happened. Those are not true reflections of a 20%. And again, I don't need anybody to foil them. I will make those emails public where you and I went back and forth on this, some other colleagues on here. Commissioner Malloy, she's been made that recommendation. I believe myself and other commissioners supported it. No, but I'm not debating that. I'm debating whether we are saying we're actually cutting 20% and we're not. What you're presenting, and don't come here and say August 27th and that has been hanging and just in the vast space of nothing for 3 months when you haven't even brought it up. You and the responsibility of the officers as well is to come back to the board, not to throw it like this out here with a 24-hour notice that we're going to talk about something that we debated extensively 3 months ago. But I keep receipts. I will post those emails for the community to see how you're lying, where I got my numbers from, and where the facts are. And in addition to that, if we as a board do not make a real 20% cut, those are additional cuts that are going to come out of our schools. And that's wrong. And it's immoral.
Let's go back.
And I don't care what Commissioner Powell has to say. I see her coming on video. If she starts to speak, I'm jumping off anyway. But for my community, I will make those emails public.
I next see Commissioner Clark on the list. Commissioner Clark?
Thank you, President White. Just had a question. The 20% cut that we're looking at today, there's nothing that prevents us from making this cut and then considering future cuts as we go along in the school year, such as the cut that Commissioner Malloy made, correct?
Oh, absolutely, absolutely. And I want to emphasize that it's one thing to say that the 20% that's reflected in this proposal is not a real cut because the reasons explained by Commissioner LeBron, and it is. This money was set aside for the 2020
It's not
budget.
a real cut, Mr. Clark. I will forward you the emails as well, but I will be posting them on social media so that the community can see exactly why they're not real cuts. And you're talking about a finance group of people who are no longer here. For the record, those individuals are no longer here.
No one interrupts you. Please give every one of your colleagues the same courtesy. It is one thing to say, this is not a real cut, and I maintain if you look at the numbers, the facts, the budget, it is a cut because that is the money that we allotted for this.
The facts were given to
LeBron, please.
You are out here trying to perpetrate a false narrative and you are lying, President.
LeBron, calling out names is not the professional, responsible conduct.
To this community and it will hurt our kids.
LeBron, really? Is this the role modeling you want to give to children?
Yes, it is. It is. Absolutely. Absolutely,
Okay.
Dan.
All right.
I don't want to have to make more cuts to schools. And I certainly don't want to make them on the premises that the board president is a liar to this
Yelling and calling names is not going to help us
It's not
solve
name calling. Those are the facts. Those are the facts. You are lying about the 20%.
Those facts, as you articulate them, are not going to solve the problem. What would solve this problem is, as Commissioner Clark suggested, or as Commissioner Malloy, if you all agree to these 20% cuts and you have specific proposals about how additional cuts can be made, which anybody could have made for the last 3 months, not just say these aren't real cuts, but to say these are the cuts that I think we should make. These are specific cuts. You didn't No one did that today, but it's okay. If someone wants to make them tomorrow or the day after, they can do that. This is a proposal that at least gets us around 20%, I maintain, easily. But if someone believes that there are additional cuts that should be made or should be proposed, propose them. That it is that simple. Thank you, Commissioner Clark. Commissioner Malloy, you know, in terms of your 20% reduction salary, I like that idea. Let's talk about it some more and maybe get it past the next meeting. But we have what I maintain was my best effort and our staff's best effort to come up with 20% in cuts. No one came up with any specific, direct, tangible cuts, additional cuts to be made. So let's make these cuts today as they stand. And if anybody has to propose anything else, let's do that tomorrow.
So for the record, I did email you tangible cuts. Again, you have a short-term memory because this was a debate that went back and forth, and I will just post the emails so the community can see that you're straight up lying.
The solution is not in calling people names. The solution is to present today or tomorrow.
Van,
Malloy did.
you forgot the whole entire debate. That's your problem. That's not mine. But these numbers are not reflective of 20%.
Commissioner LeBron, my only goal is to get us to 20%. If other people have a suggestion about how to do that, they can do that, as Commissioner Clark suggested, in the very near future. Nothing is preventing anybody, yourself included, from making specific, tangible cuts in subsequent meetings. So unless let me check the participant screen, make sure there are no further questions or comments. I see Dr. Myers, you had a comment?
Sure. I don't even want to throw a monkey wrench into this conversation, but we are going back as a team to look at what additional 5% and 10%. So central office is actively doing that right now. Because again, as you said, we're really trying to make sure that we look at as far away as we can, knowing that we might have to do some other things, but they're going to be coming up with those figures before we go away for break for additional 5 and 10.
This could, in fact, just be our baseline. This is a start, and that's what I'm calling for today, a vote on getting us started on specific cuts. Again, I see a 20% perhaps cut in our salaries that a board member has suggested, but let's hear that proposal within the coming days and we'll go from there. So, all right, any further questions or comments? There being none, I would like to, if you all don't mind, I would like to take a vote on this proposal. It is not an official, well, we could call it a resolution, or we could just have a vote for the record to indicate what specific cuts the board is proposing as of December, what is the 10th?
President White, Dr.
Yes,
Jallo has her hand raised.
Oh, I'm sorry, I didn't see that. Dr. Jallo?
Yeah, just for clarity, are you saying that tonight you only have one proposal? You only have one proposal for cuts for the board other than the proposal that was shared by Commissioner Malloy?
Yes, and again, let me repeat, and I think the transcripts and the video will make it very clear. And the number of occasions that I brought this up, I asked for any other proposals that people might have, and there's never been one shared with the entire board. And that doesn't mean that there can't be additional ones in the future. But again, let me repeat, our superintendent said, hey, listen, we need to fish or cut bait. We need your 20%. And this is the result.
I just want for clarity, I just want to make sure as of tonight, you only have one proposal.
I only have one proposal.
I need some clarity as to why we can't make a motion to add Commissioner Malloy's proposal to this proposal and amend this proposal, because that's the only cut where I see that has some viability to recoup some funding. So if there is a way, I would like to make a motion to add the 20% reduction to the board salary.
Anybody want to be heard on that? And I'll take the first response. If usually I keep my response to the last. Okay, that motion, that proposal has been seconded. Let me just be the first to provide a response to that, as I am normally the last person to respond. I think any proposal requires some degree of deliberation. I think it's a good proposal. My initial response is it makes sense. But the whole reason behind preparing a written proposal is that people have a chance to respond and deliberate and make a decision. So as a number of people said previously, this proposal could be made next week and people would have a chance to deliberate. We could figure out how much that would represent and people could come back and vote. I personally, this proposal, once again, has been before this body for quite some time. It is natural and it is, I think, reasonable to expect people to vote on it, yay or nay, tonight. Commissioner Malloy, to your recommendation, I, with all due respect, I think it's a good one. My response is I would probably vote in favor of it, but I think people are entitled to have, in any deliberative body, the opportunity to review it, see what the numbers are, and vote on it, let's say next week. That's my response. Anybody else want to be heard?
Is there a motion on the floor? I thought, are you giving comments to a motion that I just presented and that Commissioner Malloy seconded? I'm confused as to why you think it would not be a motion that's on the floor right now for a vote.
Well, even with motions, Commissioner LeBron, you have an opportunity to discuss. So I said,
so there's a motion on the floor. We're just debating the motion then on the floor.
That's right.
Point of order, Mr. President.
That's right. Commissioner Powell, I see that you have raised your hand. Go ahead.
Yeah, mine is a point of order. The motion that Commissioner LeBron has proposed is actually a motion to amend, but we don't have the motion to act on the original. So if we could back up a little bit, I'd like to move the original proposal that was communicated to the board by email.
I'll second that.
That motion has been moved and seconded. Any further discussion on the original motion, which is encapsulated in the proposed 20% board budget cuts that was provided to you? Any additional comment?
To put this on the floor, so is there a second motion that needs to be made for an amendment? I think I need legal to jump onto this call for some clarification on how to move this with both this document on the floor with the amendment to add Commissioner Malloy's suggestion of 20% reduction to the board staff.
Okay, was there an actual original resolution before the body, like is a written resolution?
No, Steve, what I suggested is that we didn't need a written resolution for this cut. What we were going to say to the superintendent is by vote is that this is what we would approve from removing from our budget. And then my thought was, and you correct me if I'm wrong, then the superintendent proposes an amended budget that would include this 20% or whatever else the board included, and the rest of our departments. She would submit that to the entire board for a vote, which is what the superintendent always does when they amend their budget. But you know, our department is part of a broader budget. That is the budget that is going to be amended when she puts together all her 20%.
Okay.
So that we were just giving her some direction about what to do with this particular department. She adds that to the rest of her departments, submits an amended budget, and then the board votes on that via resolution.
All right, so what we have then is the document that Kalia had for you all, which contains this proposed budget cut. So has there been a motion to accept that on behalf of the board as a proposal to advance the superintendent? There's been a motion and a second, because I didn't know if there was a second on that one.
Yes, Commissioner Powell moved it, Commissioner Clark seconded.
Okay. And then you open for discussion, but at the same time, then we had a proposal, well, we have a motion for an amendment from Commissioner LeBron, right?
Correct.
To the original, okay. So what we actually need to do then is take a vote as to whether or not and was there a second to did Commissioner Malloy second or?
Correct.
Yes, okay. So what we need to do is resolve the amendment motion first. So have we opened up the floor for discussion on the amendment motion?
So I made actually the amendment first as a motion where Commissioner Malloy first seconded. And then according to Commissioner Powell, we actually had to put the original document up through, up for a motion, which is where I'm asking for a point of clarity. I thought you had to make a motion to amend the document first before you presented the document. But I just want to hear from legal, what is the process to amend it tonight? I don't care if this proposal is on there. I think the only viable piece of this so-called budget cut is the 20% from staff salary, which I 100% support. And since President White continues to stress that we can no longer wait to make these decisions, tonight would be the night to make that proposal and have the board vote on it so that we could be reflective.
Okay.
Steve, if I can, on a point of order, I actually heard two different things, and I want to make sure that the amended, proposed to amend the proposal, the 20% cut, is clear. I thought Commissioner Malloy, and Commissioner Malloy, you'll correct me, I thought you said a 20% cut to board members' salaries. But Commissioner LeBron, and you correct me if I'm wrong, I thought I just heard you say a 20% cut to board, the board salaries. Were you referring to, just for clarity, just the board or board staff?
The board staff. And Commissioner Malloy, I'm assuming, and you can correct me too, that you said 20% of board members' salaries.
Okay, so it sounds to me like,
Malloy, is that correct?
Sounds to me like they're two separate things. Commissioner Malloy, you said board members' salaries, and it sounds like Commissioner LeBron, you're saying board staff salaries, including the board.
No, I'm saying board members' salary. Board members' salary.
All right. All right.
But I'm asking Commissioner Malloy if that's what she also meant, so that we're all on the same page.
Yeah, I didn't mean the board staff. I meant board members themselves.
All right. I just want to make sure. All right. Steve, were you going to say something?
Can I suggest a slightly less cloudy path through this?
Sure.
You have a motion on the floor to accept the document Kalia put forward. It does not necessarily need to be amended to include a second round of cuts. We could vote on that now, and then Commissioner LeBron can make, or Commissioner Malloy can make a new proposal for a resolution to put the board member's salary cut before us, and they don't have to exist in the same we're getting very, very cloudy at this point. So since we have a motion on the floor, and I'm unclear as to whether the amendment motion even was done properly, if it's okay, I would recommend we take them as two separate items. I just think that's the cleanest way. So if there's a motion on the floor right now, and I understand there is, it's been properly made and seconded for the original document, which is Kalia's. Why don't we have a discussion, or if that's been done, then take a vote, and then we'll move on to the next item of business.
I think there has been, I'll check the participant list, but on that particular motion, I think there has been sufficient conversation. I see Commissioner Powell. Is that an old hand? Commissioner Powell? Oh, I see it's gone down now. All right, so let's go ahead and take a voice vote on the proposal. Our general counsel is calling it Kalia's proposal, but it's a 20% cut. It is not her proposal, by the way. It is a proposed to cut 20% from the board's budget as it exists right now. So I'll go ahead and take a voice vote. All those in favor of passing that particular proposed budget cut, indicate by saying yes when I call out your name. And by the way, I'm just going to do it by the Brady Bunch screen. And please make sure your visual is on. Commissioner Malloy?
Yes.
Commissioner Clark?
Yes.
Commissioner Powell?
Yes.
Commissioner Vice President Elliott?
Yes.
Commissioner Adams? Thank you. Commissioner LeBron?
No, because it's a fake 20%.
Commissioner LeBron, just your vote, please. So I assume
no,
that's
it's
no.
a fake 20%. I want that on the record.
That is a no. All right. Now, I assume that there is a motion. Let's go this way. Let's just do a new motion. Commissioner Malloy, are you making a motion to amend the motion that was just passed by the Board of Education to.
I don't think
I don't
you
think
need
we
to
need
do
to
that.
amend it. I think we're discussing having a brand new resolution,
Yep.
right?
Well, but in order to do that, we got to get it on the floor first.
Yep, I'm gonna make a motion to
Well,
cut
that's-
20% of the board member's salary. Commissioner Malloy, would you like to second it?
Commissioner LeBron, that's not your role here.
Commissioner Malloy, would you like to second it?
LeBron, please be respectful
Thank
of the
you.
roles that we have. As I was just trying to
It's on
do,
here.
Commissioner LeBron, please, you can perform your function without being disrespectful. Kalia, would you try to make a point?
I did just have one question for
Yes,
Mr. Sparling. With the motion that was already on the floor with the amendment, does that mean the motion has dropped, or, I mean, because the motion, normally, if we have a motion already on the floor, it has to be resolved?
No, what I was trying to do, we just passed that 20% reduction. What I was
Correct,
trying
and
to do-
I have documented that.
Okay,
It's
all
the
right.
second one.
So all I was trying to do is begin a new conversation about an amendment. And I was looking first to Commissioner Malloy to propose an amendment to the motion that was just passed. And that amendment would be to include a 20% reduction on board members' salaries.
The legal.
Is that your motion, Commissioner?
To step in on this, just because I don't want an amendment to the resolution. He had recommended that we not convolute things by having something that's independent.
Oh, I get it,
So it's
Steve.
a
I
new amendment- it's a
understand.
new-
I get it.
Okay.
So you just want to have a conversation about a 20% reduction?
No, I
On
want
our
a
salaries.
motion for a 20%
On our salaries.
conversation and have Commissioner Malloy second it.
Commissioner LeBron, please, just let
I
us.
put the motion. The motion's on the floor. Commissioner Malloy, are you seconding it?
Yeah,
Commissioner LeBron.
Thank you.
Promotion.
That's it. The
Commissioner
motion's
LeBron.
on the floor.
Commissioner LeBron, and to all my colleagues, we can get through this, but we can get through it in a very respectful way. And sometimes there is misunderstanding, and we have to be patient with each other. We don't have to be disrespectful in response to that impatience and in response to that imperfection. So again, Commissioner Malloy, you've made a motion. Commissioner LeBron has seconded it. Now we'll have
I
discussion.
made the motion. Commissioner Malloy has seconded, and I want
Okay,
that.
Commissioner
Thank
LeBron, you made the motion. Commissioner Malloy seconded it. Now we have to have discussion on the motion to cut 20% from board members' salaries. We're there now, right? Okay. I'm gonna look at my participant screen and see if anybody has any comments, any hands being raised. I don't see any. Again, I will repeat the comment that I made earlier. I'm generally supportive of a 20% cut to board member salaries. However, I think in all instances, whenever you have a proposal like this, you ought to be deliberative. This is the first time this proposal has come up. I think first time this proposal has come up in this context, and people ought to have the opportunity to deliberate over it. We ought to see what that 20% amounts to and have it calculated and then vote on it next week. That's my opinion. I'll look to the participant screen to see if anybody else has any comments. I see Commissioner LeBron, you've raised your hand.
I just want to, again, put it on the record. This is actually not the first time Commissioner Malloy has mentioned it. And she's mentioned it in emails, she's mentioned it in meetings, she's mentioned it in passing. I just want to put that out there. She has had one-on-one conversations with folks about it. So I want to be clear, this is not the first time. It's 20% of whatever the salary is. It would be a bigger cut for you, President White, but I support that too. And so if there are no other comments, I think we do go straight to a vote, and we can vote right now. But I do think this is the right thing to do, given a recession, given the fact that we are going to be making some significant cuts again in schools, that we take the leadership role in this and make cuts to ourselves as well.
Let me look at the participant screen. I do see Vice President Elliott.
Yeah, let me just say I'm not in favor of it, but I would also say that I would want to table this and have more discussion about it. I do not want to make these kinds of decisions haphazardly. So I don't know what it means if I were to offer that this be tabled. and have further discussion around it. I don't think it's something that we should be voted on tonight when we're just, most of us are just hearing about it in this kind of a formal format. So I'd like for it to be tabled.
So a motion to table has to be first seconded. Is there a second to Vice President Elliott's motion to table? I'll second it. A motion to table, as our general counsel will tell you, our parliamentarian, goes straight to a vote. There is no discussion on a motion to table. So if you would turn on your screens, I'll call for a vote on Vice President Elliott's motion to table. I'll just do the Brady Bunch screen. Commissioner Malloy.
No.
Commissioner Clark.
Yes.
Commissioner Powell. You're
Sorry, yes, yes to the table.
Commissioner Elliott.
Yes.
Vice President Elliott.
Yes.
Commissioner Adams. You're muted.
No.
Commissioner LeBron.
No.
And I vote yes. The motion to table. Vice President Elliott, we normally, it's my mistake, we normally call for a motion to table for a date certain. Would you mind a friendly amendment to your motion to table? Madam Clerk, could you give us a date so we can table it for a date certain?
The next available special meeting is on the 15th of December. That's next week, Tuesday.
Okay, so.
Yes, I'll accept that.
We're going to retake that vote just to make sure that the record is clear. This is a motion to table Commissioner LeBron's proposal to December the 15th. Is that what you said?
Correct. That's the next special meeting.
So let's take the vote on that amended motion to table. Commissioner Malloy.
No.
Commissioner Clark.
Yes.
Commissioner Powell.
Yes.
Vice President Elliott.
Yes.
Commissioner Adams. I didn't hear.
No.
Thank you. And Commissioner LeBron. You're muted.
No.
And I'm a yes. So that motion to table has been moved to December the 15th. Folks will have some time, as Vice President Elliott said, to deliberate over the idea. Madam Clerk, if you could be so kind as to provide a calculation for that 20% cut so that people could have the information they need and make sure that is provided before the 15th of December. All right, Madam Superintendent, I believe you have, you're in a good way to getting the cuts that you requested from the Board of Education. There may be, as you just heard, some additional cuts that will come on December the 15th. Do you have any further questions or comments about what was passed today?
I do have a question, a couple of questions. One, I know that you asked Kalia to give you the what the actual reduction or the 20% reflects. But in order for commissioners to make an informed decision, is there anything else that since it was Vice President Elliott's, is there anything else that you need so we can be prepared? And then, pardon?
Good question. No, I was just going to say that's a good question. Is there any?
I don't. Am I supposed to respond since I made the motion, or?
Yep.
I don't like making hasty decisions like this.
Okay.
Although it may be a great idea to do it, but I'd rather have some time to reflect. I'm not sure, Madam Superintendent, what questions I have at this point.
Okay.
If you could just give me an opportunity to maybe send some questions through Kalia. I think one of the questions that the president asked, what does that mean in real dollars and cents, so to speak? I'm sort of using some different words, but what does that mean in dollars and cents? So I think that, getting that kind of information, I think is going to be helpful for me to make a decision. Okay. And I'm not doing it just because it's the political thing to do or the right thing to do. Those things I don't care about. you know, what does this really does this really make sense to do for us? So thank you.
And then
President White, I had a question also.
Sure.
And it related, I do agree. I would like to see dollars and cents as to how much is this going to really save the district. And also number two, superintendent indicated she will be coming back with probably coming back with additional cuts. And the question is 20% enough? I think once we get the data, we're able to analyze it, then I feel I can make an informed decision.
And if you all recall, when this conversation began, that's essentially what I said. I never, Commissioner Malloy, to your point, I never, as they say, poo-pooed the idea. I just thought that, as Commissioner Clark and Vice President eloquently said, we should have the time to deliberate over good ideas. And by the way, I know it's not the first time you've raised the idea. It's just, this is the first time the board is being asked to vote on the idea. So a week will not deter, I think, your well-intentioned effort, and we'll all have the information that we need. And let me just also add, I think that's what citizens expect of us. They expect us to be armed with the facts and the information before we make a decision. So, all right, our path forward is pretty clear. Is there any other business for the good of the order? All right. Madam Clerk, were you going to say something?
There are a few hands up in the.
Okay, I'm sorry. I didn't see that. Commissioner LeBron. Commissioner LeBron.
Yeah, I just want to say, Mr. Clark, I know that you're new and you probably have not had a chance to look through numbers, but I do know the numbers. And I also know this conversation with this proposal. Like I said, there's a long history of a back and forth email. And these numbers, you cannot say that you're making cuts to a new budget with decisions that you made last year and also in December, by the way. So it's not a true reflection of 20%. And when we're talking about we taking cuts, us, we have a responsibility to make those cuts here at central office first, here at this board level, whatever it could be. You know, Commissioner Malloy started at 20%. I would be willing to go even higher, knowing that we're about to cut people from our kids. And I know, Mr. Clark, I don't want to take out my frustrations on you. You didn't cause this, you just got here. But I'm very passionate about this, but I also have a daughter in this district that will be directly impacted one way or the other. I know Commissioner Malloy has kids in this district that are gonna be impacted by these cuts one way or another, and same thing with Mr. Adams. And it just pisses me off that we're in this hole because this board operates in this way of putting things off and not being appropriate to make the decisions that they need to make when they need to make them. So with that said, I'm looking for the emails now. I will forward them to you. And we need to make some real cuts, and we need to start with ourselves, and we need to start at central office and with the board budget and the totality of the board budget.
Commissioner Malloy.
I'm looking forward to Tuesday's discussion. I think we need to have a robust discussion on this matter. And if our own sacrifice can be a good example for our community, if our own sacrifice means that we save even one paraprofessional or, you know, some of our Bente employees, I'm all for that. Thank you.
Yeah, like the rest of you, I look forward to that discussion. Let me just make sure there's no further discussion tonight. And it doesn't appear that there is. So the only other thing I need at this particular point, unless our clerk or our superintendent tells us that I've missed something on the agenda. Yes. For you, Commissioner Powell, I would have forgotten.
Thank you, Commissioner Powell.
All right, Madam Clerk, can you put that survey up for us? Thank you. Again, those watching for the first time, at the end of every meeting, we evaluate how we did according to our own standards of conduct and whether we accomplished something that made a difference in the lives of our students. And we submit those opinions by answering 10 questions, and that's what we're doing now. Was that a motion to adjourn made by Willa's dog? I think that was. How are we doing on the responses?
We're still waiting on the remainder of the responses.
He seconded his own motion, Willa, it sounds like.
He doesn't want to be photographed. Shh, shh, stop.
For the folks watching, we wait till every board member has completed their survey. And then, of course, as in any meeting, we wait for a motion to adjourn, and motion is seconded. And then we go home to our families and hope that our families are safe as well as yours. Are we set, Madam Clerk?
We are all set. Thank you.
Can I get that motion?
So moved.
Oh,
I heard a couple people, Commissioner Powell, and I think I also saw Commissioner Malloy raise her hand. All those in favor of adjourning and going home to our families indicate by saying aye. Aye.
have a
Good night. Good night, everybody.